Good morning, dear students. Let us start today's class with a small prayer. Lord Jesus, we surrender all children into your heart. Bless them with your love and care and help us to provide healing hands and smiling face during their journey. Lord, make me as an instrument of your peace, love, and healing. Amen. Ave Maria. Okay, now we will start with the disorders of the cardiovascular system. Okay, all the disorders of the cardiovascular system can be divided into two: congenital heart defects and acquired heart defects or cardiac defect. Okay, congenital, from the word meaning, the defect is present at the time of birth itself. So congenital heart disorders are all those defects present at the time of the birth. Of course, since it is present at the birth, it is a developmental problem. Okay, and the second classification is acquired cardiac disorders. Example is rheumatic heart disease. We will learn all these conditions after learning congenital heart defects. Okay, it is not acquired heart defects are not present at the time of birth, but it develops afterwards due to infection, due to inflammation, secondary to some other problems. Okay, so acquired heart disease are developed after birth. Congenital heart defects are present at the time of birth. Okay, now we will see in detail regarding congenital heart defect. What is congenital heart defects? Congenital heart defects or congenital heart disease, it is an abnormality present at the heart. So usually majority of the condition, it is an anatomical defect that is present at the time of birth. Okay, now we can see that how this disorder affect. This disorder affect heart valves. Okay, it may be anatomical defect in the heart valve. Next, heart walls. Okay, so any part of the wall is getting, example ASD, the wall is not formed well. Okay, so there is a defect, there is a hole. Valve disorder or regurgitation, atresia of the various valves, all those are the valve disorders. And again, disorders to the great blood vessel, coarctation of aorta, and even the transposition of great arteries. Okay, these are some of the examples of great disorder to the great blood vessel of the heart. So congenital heart defects effects can be mainly three areas that are affected. It may be heart walls and valves and the great blood vessels. Now let us see what is the definition of congenital heart disease. Congenital heart disease is a structural malformation of the heart valves, great vessels that is present at the time of birth. Okay, so congenital heart defects means it is a structural abnormalities of the heart. It may be any part of the heart, or it may be the valves of the heart, or it may be even the great vessel. Okay, second one, anatomical malformation of the heart or great vessels, which occurs during intrauterine development, irrespective of the age at present. That means where it shows the features. Okay, some of the cardiac disorders we may not identify at the time of birth. Okay, irrespective of when it shows its signs and symptoms, if it is due to any anatomical malformation which occurred during intrauterine life. I told you, to have a disease at the time of birth, it should develop during the intrauterine life. So any malformation of the heart which developed during structural abnormalities, that is developed during intrauterine life, intrauterine development, can be called as congenital heart defects, irrespective of when the signs and symptoms shows. you can study any one of these. Next, we will move on to the incidence of congenital heart disease. Okay, congenital is the heart disease is the most frequently occurring congenital disorders. Okay, among all GI, genitourinary. Okay, among all congenital heart disease is common, and this constitute almost 28% of all congenital defects. So it is almost more than 1/4 of this condition, congenital heart defects. Among that, cardiac is a common one, 28%. And the birth prevalence of CHD is reported to be 8 to 12 out of 10,000 live birth. How much prevalent it is? Okay, so that is 8 to 12. This 28% means among all the congenital malformation, cardiac defect is only 20%. Okay, now when we compare, now we take into account that congenital heart defects in normal live birth. Okay, that is almost 8 to 12 out of 1000 live birth. And again we can see that the right-sided lesions are common in female and left-side lesions are common in male. Okay, right-side lesions are, many times it is less severe than the left-side lesions, and the right-side lesions are common in female and the left-side lesions are common in male. Okay, that is about the incidence. Let us see the reason of congenital heart defects. Exact reason is still not known, but we can see there are some factors that is contributing to. Okay, so the exact reason is still need to be identified. So what are the factors? The factors can be divided into two: genetic factors and environmental factors. So the causes of congenital heart defects, exact cause is still not known, but the factors which associated with these defects can be divided into two, that is genetic and environmental factors. Genetic factors occurs with the involvement of gene. Okay, so first one is the heredity. Okay, if the parents are having the disorders, then there is high risk in those children. Okay, whoever children have the parents with cardiac problem, they are at more risk. And even it is found that siblings and the offsprings of the individual with even the siblings also can have high chance to get this particular condition. So we can understand that there is a common genetic factor. Next is the mutation. What is mutation? Mutation is the sudden heritable change that occurs in the gene is known as mutation. I may not have a cardiac defect. Okay, imagine that after the, before the reproductive age, if my gene undergo a mutation due to any of the exposure, okay, now what happened? My gene is having a problem of or indicating a cardiac defect. That means my children can have cardiac defect. I may not suffer. Any one of my ancestors may not have cardiac defect, but if mutation happens in me, there is high chance for getting my children. So mutation, what is mutation? Mutation is a sudden inheritable change that occurs in the gene. Okay, so that is leading to this condition, cardiac defect. So second is the mutation. Third is, we can see that majority of the time this congenital heart defect is not a single defect, but it is associated with many of other syndrome. A syndromal abnormality, genetic abnormality. Example, Down syndrome, Turner syndrome. Okay, all these children, and even when I visited a cardiac hospital for 15 days, we get actually anxious because majority of the children who are coming to this particular hospital and paying such an amount and undergoing the surgeries and recovering, but they all have one or another, yes, chromosomal abnormality. They will never become perfect in the life, but still parents are willing to take care of their cardiac problems. Okay, really we must respect them. So we can see that there are genetic factors because it is found among the siblings and offspring of the affected children, affected patients, and even mutation. Okay, it can occur if even if all the parents ancestors are not there. If mutation happens, okay, they produce a cardiac defects, children with the cardiac defects, and linked with other major defects. Okay, many of the time it is associated with the other chromosomal abnormalities. Okay, that is about the first cause, genetic factors. Now let us see what are the environmental factors which can contribute or which can cause cardiac problem. Okay, any of the viral infection which occurs to the mother during the first trimester can lead to cardiac problem. Example, STDs are common. Rubella, okay, rubella can cause cardiac defects. And even intake of medications like lithium. Okay, as you know, lithium we are taking for the in order to manage the bipolar disorder. Then Accutane, okay, that is an acne medication, okay, skin medication, and thalidomide, okay, that is usually previously it was given for the morning sickness and even sedation, and some of the anti-seizure medication. Okay, these drugs, if the mothers are taking, there is high chance for developing cardiac problems in the children. Lithium, Accutane, okay, that is an acne medication, thalidomide, and thalidomide, I think I have told you already. Once I have seen a paper cutting saying that, okay, Malsi Kanniga has born in somewhere North India. Actually, it is not a, when I looked into the picture, it is not a Malsi Kanniga. Instead, it is a fused leg. It is a typical thalidomide affected baby because this baby have a baby born with a two fused leg. Since the fused leg means it looks like a end part is looks like a fish, so they thought that it is a malsaganiga. It is not a so upper part there is no problem, only lower part is fused. So this is the typical how it looks at thalidomide affected baby. And even if the mother is on any okay any anti seizure medication, here also some of the medication, not all the medications, some of the medications can cause cardiac defect. Then alcohol. What happens if the mother takes alcohol during intra when the baby is in intrauterine life? Okay, when she is pregnant. Okay, here it may not be common, but it is coming up in India. It is common in abroad. Okay, so if the mother takes regularly alcohol content in the baby's blood also increases. So baby also will have fetal alcohol syndrome. Okay, now even if you take any of the foreign books, if you take first disease condition is the alcohol withdrawal syndrome of a baby. What happens once the baby is separated from the placenta? Nobody will give alcohol to the baby. But what happened? The baby is not getting alcohol through the blood. So baby shows the features of a withdrawal syndrome. You might have seen the patients with withdrawal syndrome. Such a rigorous, okay, violent behavior may not show, but the babies have irritability, cry, continuous cry. They may show it is for the few days. Okay, since it is common there in abroad, when they take the history, they take the history of the mother's alcohol history and they will be carrying the baby. Next is the cocaine. Okay, if the person is smoking, okay, passive smoker or active smoker, the cocaine we know that it is not good for the cardiac and even the respiratory tract. So the cocaine may cause the what is that, shrinking of all these, and again it is against the development. Next is the maternal chronic illness. Example, the mother is having diabetics, the mother is having phenylketonuria and deficiency of vitamin A, B and folic acid. All these can cause cardiac defects in the children. And again, if the high altitude oxygen saturation, oxygen availability is less, and another condition is the hypercalcemia. Hypercalcemia, the exact reason is not known. The incidents are found like the children with infants with hypercalcemia. If we go for a cardiac checkup, they may have cardiac condition. So hypercalcemia, the infants with hypercalcemia, we can see more cardiac defect in such a children. So these are the environmental factors. So viral infection, some of the medications, alcohol, smoking, maternal chronic disorder like diabetes, phenylketonuria, and vitamin deficiency, vitamin A and B deficiency, and folic acid deficiency, high altitude, and hypercalcemia. Now let us see how the congenital heart defect is classified. Congenital heart defect mainly can be divided into two: acyanotic and cyanotic. As the word indicates, the disorder which causes cyanosis, we can call it as acyanotic. Which does not cause cyanosis can be called as acyanotic. In this acyanotic, baby have the heart defects, but the baby will not develop with the cyanosis. So what is cyanotic? Okay, here the baby has cardiac defect and the baby will show cyanosis as a feature of it. Okay, again acyanotic. Acyanotic means cardiac defect is there but there is no cyanosis. Okay, acyanotic heart defects can be again divided into two: heart defects with increased pulmonary blood flow. Okay, these are the defects where it causes to increased pulmonary blood flow. And the second time is there is obstruction to the blood flow. So acyanotic heart defects can be divided into two: defects with increased pulmonary blood flow and even defects which cause obstruction to the blood flow. Okay, now we will see detail what is the acyanotic heart disease with increased pulmonary blood flow. Okay, the first is ASD. What is ASD? Atrial septal defect. So what is that? Atrial septal defect. There is defect in the atrial septum. Okay, so that is known. So there is formation. Yesterday you have seen the development of heart. In that they have explained how the ASD is forming. Okay, an opening in the atrial septum is known as ASD. It is a normal opening in the atrial septum. Yes, foramen ovale is there and it is present at the time of intrauterine life in order to divert the blood from the right atrium to the left atrium. But after the birth, because of the pressure variation, physiologically it closes, functionally it closes. So there is, that will not act as an ASD. Okay, so any other opening that is present at the septum of the atrium is known as ASD. So the second defect is VSD, ventricular septal defect. Ventricular septum. So here again a defect in the ventricular septum. Okay, so an opening in the ventricular septum is known as VSD. An opening in the septum of the ventricle, septum of the atrium, ASD. Defect in the septum of the ventricle, it is known as VSD. Okay. Now, next disease condition is the PDA. What is ductus arteriosus? Okay, and PDA means patent ductus arteriosus. That means it was patent before, but after the birth it should not be patent. If it continues to be patent, it will become a defect. Okay, so ductus arteriosus. Ductus arteriosus is a connection, okay, that is between the pulmonary artery and aorta. Okay, as you know, in intrauterine life, the oxygenation happens mainly from the maternal blood to the fetal blood. Okay, lung is not acting Okay, regarding oxygenation. So lungs require only very less oxygen. So majority of the blood need to go to the systemic circulation for the development of the other part of the body. So only less amount of blood is required for the pulmonary artery because only for the development of the lungs. So what happened? Since the pulmonary artery carries more blood, so the blood can move from the pulmonary artery to the aorta because the pressure in the right side is high than the left side. So the pressure in the pulmonary artery is high than aorta during intrauterine life. So what happens? Through the ductus arteriosus, the blood moves from the pulmonary artery to the aorta, which is normal in intrauterine life, which is normal in intrauterine life. And usually PDA is commonly seen in preterm baby. Okay, but what happens if it remains? Okay, at the time of birth, there is a pressure variation occurs between the right and left side of the heart. Now the pressure of the blood moves and the lung is open. Baby start breathing. The pressure in the right side reduces and the pressure in the left side increases. So if the ductus arteriosus is patent, what happened? The blood will move back from aorta to the pulmonary artery. So the blood which is supposed to go to the systemic circulation will come back to the lungs again through the pulmonary artery. It causes, according to the level of blood flow, it may cause even congestive cardiac failure to the baby. So that is PDA. Okay, the next is the atrioventricular canal. Canal. So we have seen defect. Okay, so what is canal? A major defect. Yes, a atrial and ventricular septal defect there is, and with abnormal AV atrioventricular valve. That means there is a massive abnormality in the atrium and the ventricular septum, including the valves, is known as atrioventricular canal. Atrioventricular canal. A canal is formed. It is more than a hole. Okay, so defect is high. The next is the partial anomalous pulmonary venous return. So what is to identify what is anomalous pulmonary venous return? Pulmonary venous return, where it goes. Okay, it is normally pulmonary venous return to the heart through inferior vena cava and superior vena cava. So what may be anomalous? Anomalous means it is not occurring, okay, like this. Inferior vena cava and superior vena cava is coming and getting attached to the right atrium. So if partial means any one of it get attached to any other part. Usually it may be to the pulmonary artery or pulmonary vein. Okay, it moves like that. So total pulmonary venous return also is present. That is a cyanotic heart disease. In total anomalous pulmonary venous return, no blood is coming back into the right atrium. Okay, so these we will see in detail later. So partial anomalous pulmonary venous return means blood from the pulmonary vein is partially returning to the right atrium. Okay, it is going to some other area. Okay, so partially it is present. It may not cause much cyanosis. That is why it is caused as partial anomalous. In case if it is a complete anomalous, okay, that is a cyanotic disease condition. So we have seen the disease, a cyanotic disease condition with increased pulmonary blood flow are ASD, VSD, PDA, AV, atrioventricular canal, and partial anomalous pulmonary venous return. Okay, now the second classification is The disorder which causes obstruction to the blood flow. The disorder which causes obstruction to the blood flow. What it is? Okay, the first one is the coarctation of aorta. What is it? Narrowing of the aorta. It causes obstruction, and the level of obstruction is again depending upon degree of narrowing and the extent of narrowed area. Coarctation of aorta. Commonly it is in the ascending and the arch of aorta, and very less in the descending aorta. And next is the aortic stenosis. So what is stenosis of the aortic wall? Okay, so the narrowing of the stricture of the aortic valve is known as aortic stenosis. So now here stenosis, so blood flow is obstructed. Next is the pulmonary stenosis. In aortic stenosis, blood is not able to pass from the right atrium to the right ventricle. Okay, aortic stenosis. Pulmonary stenosis, what happened? Pulmonary stenosis means there is a narrowing of the pulmonary artery. Narrowing of the pulmonary artery is known as pulmonary stenosis. Okay, so these are the three conditions which causes obstruction to the blood flow. So this is under the cyanotic. Now we'll see what are the disease conditions coming under cyanotic heart disease. Under the cyanotic, there are two type of disease condition. The cyanotic heart defects with a decreased pulmonary blood flow and the cyanotic heart defects with a mixed blood flow. Okay, so first we'll see what are the cyanotic heart disease with a decreased pulmonary blood flow. First is the tetralogy of Fallot. The tetralogy, as you know, it is a common condition you might have learned in GNM. Tetralogy of Fallot. It is a complex condition of severe congenital defect. What are the four defects? Ventricular septal defect, VSD, pulmonary stenosis, overriding of aorta, and right ventricular hypertrophy. For the combination of all these four conditions can be called as tetralogy of Fallot. Fallot is the person who identified this condition. So tetralogy of Fallot, a complex condition with four abnormalities. Even if you go to the clinical area, you can see tetralogy, pakka tetralogy to see it is rare, but pentology is there if one more condition is added, and triology if anyone is missing. Okay, it is called as triology. Okay, pentology was common when I went down the tetralogy of Fallot. We do not have it in our syllabus. Ventricular septal defect, pulmonary valve stenosis, overriding of aorta, and right ventricular hypertrophy are the four conditions which is found in tetralogy of Fallot. If we look into exactly two defects we have, pulmonary venous return and ventricular septal defect. Other two are actually developed condition associated with this. Okay, second is the tricuspid atresia. Okay, tricuspid valve is absent. Okay, absence of tricuspid valve is the tricuspid atresia. So these are the two conditions that causes cyanotic heart defects with reduced blood flow to the lungs. Reduced blood flow to the lungs. Okay, now what are the other conditions? These are the some of the other diseases which caused mixed blood flow. So here there is a mixing between the oxygenated and deoxygenated blood. So first is the transposition of great artery. Great arteries. Which are the great arteries? Aorta and pulmonary arteries transpositioned in this condition. Okay, what is the normal condition? Normally, pulmonary artery is starting from the right ventricle and aorta is starting from the left ventricle. So what may be this defect? It is transpositioned. Transposition means aorta is starting from the pulmonary ventricle. where pulmonary ventricle carries deoxygenated blood. So what blood reaches to the systemic circulation? Yes, it is deoxygenated blood. Okay. Uh, and what happens? And oxygenated blood from the left ventricle, where it goes? Through the pulmonary vein, it goes to the through the pulmonary artery. Sorry, it goes to the pulmonary through the pulmonary vein. It goes to where? It goes to the heart itself. Okay, so oxygenated blood is continuously going back to the heart, and deoxygenated blood is going for the systemic circulation. So here the systemic circulation is having deficient oxygen supply and leading to major problem in the baby. So this is the transposition of the great arteries. Now total anomalous pulmonary venous return. Okay, we have seen that. Total anomalous pulmonary venous return. So what happened in this condition? Okay, there is no connection. Okay, as I told you in the partial, it is complete. Okay, the blood which is coming back from the systemic circulation to the right ventricle is getting connected somewhere else, not in the right ventricle. Okay, so that is the total anomalous pulmonary venous return. No direct communication between the pulmonary vein and the left atrium or to the right side. But instead what happened? It goes to the left side of the heart. Okay, so again it is deoxygenated blood is coming back to the left side of the heart. It is causing trouble. Okay, so that is why it causes cyanosis in the children. Okay, next is the truncus arteriosus. Truncus arteriosus. Okay, when you have seen the development, you have seen that the pulmonary artery and the aorta is begin as one major blood vessel, and afterwards it is getting separated as two blood vessels. Okay, but here in this particular what happened? Yes, it is not getting separated into two artery, that is aorta and pulmonary artery. Aorta and pulmonary artery. Okay. So what happened? Okay, so that is the truncus arteriosus. So here only one major, yes, one major blood vessel through which the blood, okay, it actually there will be a defect also, canal defect also may be there. So blood from the both right and left enters into the common, and the branching also is defect, and sometimes the major branching may divertify the blood vessel. Okay, depending upon that we will learn the disease condition in detail, and I will teach you. Okay, the last one is the hypoplastic left heart syndrome. What is hypoplastic? Hypoplastic L is different. Okay, hypoplastic, there is a spelling defect. Hypoplastic L is not there. Okay, you can cut it off. Hypoplastic left heart syndrome. So this left side of the heart is not developed. Hypoplastic left heart syndrome. It is not, left side is not developed. So these are the four conditions which causes mixing of blood, transfusion of great arteries, total anomalous pulmonary venous return, truncus arteriosus, hypoplastic left heart syndrome. So this is about the classification of congenital heart defects, mainly broadly divided into two, acyanotic and cyanotic. Acyanotic is again divided into increased pulmonary blood flow and obstruction to the pulmonary blood flow. Increased pulmonary blood flow, ASD, VSD, PDA, atrial canal, partial anomalous pulmonary venous return. Obstruction to the blood flow occurs in coarctation of aorta and aortic stenosis, pulmonary stenosis. And second classification is cyanotic heart disease, where the if children suffer from severe cyanosis. Okay, under that there are two types, cyanotic heart defects with a decreased pulmonary blood flow are TOF, tetralogy of Fallot, and tricuspid atresia. And the cyanotic heart defects with mixed blood flow are transposition of the great arteries, total anomalous pulmonary venous return, truncus arteriosus, and hypoplastic left heart syndrome. So now we have learned regarding. Uh, I will send you the note. Okay, both notes I will send and study from the note, and you can refer your book. Okay, if there is any doubt, you can ask me. And my portions are mainly from Marlowe and even your books, Rumbul Sharma, and even Wali and Wong. Okay, thank you. Thank you.